Hello everyone, welcome back to our channel. Please like and subscribe if you like our work. Today we will talk about what is public health and its importance. To better understand what is public health, first we need to have a basic concept of health. World Health Organization defines health as state of complete physical, mental and social well-being and not merely the absence of disease or illness. Now we know what is a health. Thus we could define public health as the science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices of society, organizations, public and private communities, and individuals. However, the definition of public health is different for every person. Thus, in a simple terms, public health promotes and protects the health of people and the communities where they live, learn, work and play. Public health is a field for people who care about the greater good of human beings. The field of public health is constantly evolving in response to the needs of communities and populations around the world. The underlying mission of public health is to improve the conditions and behaviors that affect health so that all people can attain it. Public health helps to keep communities healthy through child wellness, disease prevention, education, disaster relief, clean water, access to healthcare, and much more. Here is some examples of public health work. Vaccination, motor vehicle safety, fluoridation of drinking water, safer workplaces, control of infectious disease. Health is influenced by many factors, which may generally be organized into 5 broad categories known as determinants of health: genetics, behavior, environmental and physical influences, medical care and social factors. These 5 categories are interconnected. Let's talk about public health in a broader context. Public health problems are diverse and can include infectious diseases, chronic diseases, emergencies, injuries, environmental health problems, as well as other health threats. Regardless of the topic, we take the same approach to a public health problem by following 4 general steps. First, we ask what is the problem? In public health, we identify the problem by using surveillance systems to monitor health events and behaviors occurring among a population. After we've identified the problem, the next question is, what is the cause of the problem? For example, are there factors that might make certain populations more susceptible to disease, such as something in the environment or certain behaviors that people are practicing? Once we've identified the risk factors related to the problem, we ask, what intervention works to address the problem? We look at what has worked in the past in addressing this same problem and if a proposed intervention makes sense with our affected population. In the last step, we ask, how can we implement the intervention? Given the resources we have and what we know about the affected population, will this work? In 1988, the Institute of Medicine defined 3 core functions of public health agencies that must be carried out at all levels of government for the overall public health system to work effectively. The 3 core functions are assessment, policy development, and assurance. Assessment is knowing what needs to be done, policy development is being part of the solution to get it done, and assurance is making sure it gets done. 10 essential public health services are grouped under the 3 core functions. These services are not a prescription for what public health agencies should be doing. Instead, they are intended to serve as a descriptive tool to capture the field of public health and to communicate what public health provides. 10 essential public health services are: monitor health, diagnose and investigate, inform, educate, empower, mobilize community partnership, develop policies, enforce laws, link to or provide care, assure a competent workforce, evaluate, research. The field of public health is broad and interdisciplinary. Beyond government, it requires stakeholders with skills in intervention programs, policies, research, evaluation, and education. The 5 core disciplines of public health are behavioral science or health education, biostatistics, environmental health, epidemiology, health services administration. In summary, public health focuses on improving and protecting community health and well-being, with an emphasis on prevention among large groups of people. Those with public health degrees keep communities healthy through child wellness, disease prevention, education, disaster relief, clean water, access to healthcare, and much more. In the next video, we will discuss the job prospects of public health. Thank you for listening. If you like our video, then please like and subscribe our channel. And stay safe.